Hi, Anne.
Hi. My name is Anne, and I've been involved with the patient reference group for 16 months now, and been working with the CCG on kind of a layperson's perspective of the consultation and the processes that we've been through up to this point.
Okay, and that's for Solihull urgent care, is it?
That's for the Solihull urgent care review, yeah.
Okay, and that involves, is that specifically for Solihull Hospital?
It's based around the Solihull Hospital site, and it's looking to integrate services that are already there in a much more accessible way for people, service users and people who are working and living in the borough.
Because I gather from the people who use it that there are various facilities scattered all over the site, in the car park and everything else, with lots of different entries.
That's right. It's a fairly kind of piecemeal approach, and the thinking is that it could be looked at in a new way, in a much more accessible and positive way, to get rid of the duplication that was going on and the confusion about where to go for what particular need.
Okay, lovely. And as far as that's concerned, do you know, are the plans to bring it all under one roof with one front door?
That was certainly the plan that we discussed and which everybody came to during meetings, and also when we went out to consultation. It was the overriding opinion of people who took part in the consultation that would be very much more helpful and something that would really help them understand the processes and the pathways that they would need to go through to seek support or help for their urgent care need at that particular time.
Right, okay, and I understand as well that Solihull has A&E type facilities, but that the name would change.
Yes, I think we talked about getting rid of the red sign and the full A&E, because it hasn't been a full A&E for some time, replacing it with a blue sign and urgent care services, replicating what's available now, but in a new kind of arrangement.
So what sort of things would you like to see?
Well, my experience of the hospital up to this point has been positive, and fortunately, touch wood, I haven't had to use the services too often. So I understand where I come from, and everybody's got a different perspective. But I guess one of the main things for me is that I want the staff who work there to kind of get and understand what the whole provision is about, that they really understand and have signed up to this approach. I mean, it's not a new approach. I understand that some of these services and these approaches are happening elsewhere in the country, and there are some very good models that we've certainly looked at and feel certainly I feel very positive about. But I do think it's important that it's not just a coming together of the services that are there now, but we've taken that step back and we actually look at how it could be in a very positive way through the user's eyes. Yeah. So that's one of my things that I'm really keen on, is that staff really are signed up to it and embrace it indeed. And I think another thing that's really important for me is about communication, both communication entering the service, entering the urgent care services on the site, in terms of lead-in, so that I know that I'm in the right place at the right time for my particular need. And we talked about 111 services being integrated with the urgent care service, and I think we need to work really hard with that, because there are varying views of the 111 service for different people. But equally, I would want the discharge communication when I finish that care that I've received, going out to my GP or going to another service. I would want that to be continuous, reliable, accurate, yeah. So that I haven't got to remember everything. Yes. So communication, whether it be IT or whether it be spoken or written, I think that's got to be really kind of nailed down as well. It's not just about what's going to be there behind the one front door. It's about how you get there and then how you come away from it and what it does for you as a citizen of the borough, really.
Okay, and as far as presumably it's also about being fit for purpose for the future as well.
Oh, absolutely. And I think we've always I think during the preparation for this, I think the kind of atmosphere has been about looking ahead, making sure that it lasts through future generations and that it is fit for purpose, but that it's flexible as well. It's not. It just meets the needs of the borough, and that's why communication is really important. And I think for people to sign up so that they give feedback, for good and otherwise, but feedback, everything is about feedback, that they need to feel that they're getting a really, really top quality service because it's worth investing in.
I think my understanding is that people like Solihull Hospital, and that, you know, and is that
absolutely, absolutely. And as I said earlier, services that I've received intermittently over 25 years has been good. And I think there are very positive, certainly again in the consultation, and I spoke to people in the general public passing by our events. They had confidence in the hospital and they really wanted it to work, but they also recognised that it had shortcomings at the moment. But we're looking to address those, and you know, a lot of people that we spoke to signed up to that.
Great.
And were quite relieved actually. For some of them, it was about time.
And is there anything else you'd like to add?
Sorry, I've written lots of things down. Yeah, I think I'm quite passionate as well about appropriate training for staff, regular training, and I'm not being patronising, but that's all part of the package, so that you know, it's built for the future, and that it is reliable and accurate and supports people living and working within the borough. I think one of the things I feel at the moment that maybe doesn't work is about passing on information. It's about all our records and the joined upness of a communication again. And I think that's really important that gets across to the service providers, is that passing on of, both taking in and passing on of medical records and information, keeping our treatment up to date is really important, so that we don't have to have times when we have to repeat our story over and over again. Yeah. Because as the population gets older, then that's going to be trickier, and so we have to have a kind of as watertight as possible communication system and passing on of record system to make people feel safe and secure, I think.
A lot of people have likened what they would like to see within a hospital service as being more along the lines of the sort of service that you would get if you went to a Best Restaurant or John Lewis, where you're valued.
Yeah, absolutely. And I think we looked at some models, and I think certainly at a couple of our meetings, the model in London was something that resonated with us. We recognised elements of it that we discussed, that we talked about as, you know, what does good or very good look like? We started from that premise. What do we really want, rather than, you know, how can we fix this bit and then move on to the next? It's like, let's take a step back and then let's have a look at what we really want, and let's go for it. And there are some really good models out there, and you know, why shouldn't we have the best for everybody in the borough? That should be our aim, really, our goal.
Well, I mean, because of Solihull being in the location that it is and being the demographic, etc. it is, we should be able to employ some of the best people, because people want to live and work.
Absolutely. It's a huge business hub and it's growing all the time, isn't it? I think if I can say another thing in terms of future-proofing, from my experiences, I do feel that looking at the service and the provision, both in terms of the environment and the staff training and the kind of staff that get it, is about making it dementia friendly. You know, there are simple adjustments that can be made that actually I feel aren't just for people who are living with dementia and their families and or carers, but for all of us. And I think that would be something that could be a real plus to take into account when we're organising the facilities and providing the guidance, the pathways to and through and beyond the urgent care service that we're seeking to put in place.
Fabulous. Anything else?
Oh, I can't remember it all.
We imagine that.
And then we can start the conversation.
Okay.
So how did you become involved in all of this in the first place? Because it's a big commitment, isn't it?
Yes, but my background is social care for 30 years, but I also linked into health as part of social care. And prior retirement, I decided I need to be looking at something else, and I wanted to come out of social care and do something with health. Health is always going to be there, and most of us are going to use it at some time in our life. So I became a governor later, then I went on to the Consultative Health Council, which we do inspections and things like that. But my line with this is with the Solihull Patient Carers Group, which is based at Solihull. And so I started to go along to the initial CCG meetings when the whole start of the new process was going on. And April last year, 2013, we had a meeting at the Bridge, and one of the big focus that day was on emergency care out of Solihull site. And it's interesting now to see the things we were coming up with and the designs we were actually look as though they're coming to fruition. So very pleased with that and quite excited about it. But I do think I live in a village outside the borough of Solihull, well, not the borough, the urban area of Solihull, and I run a patient carers transport system. And so I get to talk to patients who come in and out of Solihull Hospital and Heartland and everywhere else, and about access, and obviously wanting to keep Solihull Hospital going as well. And one of the biggest areas that we find, particularly with the elderly, we just don't know where to go.
Yes.
Don't like dialing 999 because they're of that age group where you're independent and you're fine, but where do we go? So do we go to A&E? Do I go to walk-in? Do I go to Badger?
Yeah.
Sorry about that. Do I go to Badger services? And when I've been talking to some about the work we were doing, and particularly when it went public and we were going out to consultation, they and many of their carers, who often aren't near and may not be living within the borough of Solihull, are just looking forward to having something where they just go to one place, and then mum or dad will get what they want. And I think for me, one of the anxieties we have is, and we mustn't lose sight of, although we've got this town of Solihull and that area, we have a big rural area, very wide rural area, and people have got to not only know where they're going, but they've got to find and be able to get into there as well. So the least the pressure we can take off them, knowing if I go there, someone will talk to me, listen to me, and guide me where I need to go in that place, and that'll be absolutely wonderful.
I would agree. I would agree. And my understanding is, as far as Solihull is concerned, my understanding is, as far as Solihull is concerned, that people like Solihull Hospital.
Yes, yes.
They like coming to Solihull Hospital.
They've fought hard to keep it open over the years, yes.
And so therefore, presumably, the plans that are afoot are to future-proof it.
Yeah. Well, the things we've been looking at is obviously a design to make things more accessible. And that the training and the way it's all set up will be easy for people to go and feel confident in. But I think where we've been looking at as well, that whatever we design is able to have some flexibility. So it's like everything, we design IT systems, but as soon as we've designed it is out of date. So we need something that we know we can change as things change. Medicine's changing daily. How people are treated are changing daily. Outside there, the communities are changing. And we're seeing in Solihull, I mean, the development of the airport, we've got a casino coming fairly soon, you've got the NEC, you've got Rover, you've got everything around here, so fine. So we need to be ready for all that, as well as the public that live actually within the Solihull area. And I think what we've designed does have some flexibility to be able to move with the times, so we haven't got to reinvent the wheel again.
Yeah. brilliant,
Yeah.
indeed. And I understand that some of the things that are proposed for the urgent care centre, which is what it will be called, are actually better than the services that are already available.
We've looked at what we've got, which duplicates itself, and as I say, we never know what time. Well, we do know what time, but you've got to go and look up the paperwork what time various things are opening. But we were looking at it being hopefully a 24-hour service, that there will be more backup systems there for people to have, that the IT system will be such that obviously hopefully they can link into this patient's record, so they know, well, make sure that they're not giving them drugs that are going to cause them problems, but also to be able to contact GPs and other people on. One of the things we were hoping, and I think this is a future thing, is to be able to book appointments with GPs when they needed to do it as well, but I think that's one in the future which the GP has now got to work to.
So presumably one of the many things that is looking as part of the future proof is to be able to grow that business according to the demands of the locality.
Yeah. Because we're changing. I mean, we're with the development, as I say, we've got Land Rover, the Tata, Indian Tata Company, we've got the NEC, we've got the, as I said before, the casino, etc. developing. There's a lot of footprint now here. And a lot of people live in Birmingham, live Coventry, live elsewhere, but they actually work in here, so would be accessing this service as well.
Yeah. I think when we were at Touchwood, actually, one of the things that was said by an awful lot of the young people is they use the walk-in service, and they use that because they come off their restaurant shift or whatever, or store shift, and find it's easier to do that than to go back to where they live.
Well, we so often think of just being for people that live in an area, and I think often we forget of all these other people that are in, including people that come in just to shop in Touchwood or come to the cinema here and things like that. So we need to be there to be able to help or be there and supportive to all of those, but we do need to make things very clear and communicate well just what this new emergency service covers. And if there's anything further wrong, they are then sort of go to Heartlands or City Hospital QE or something in that way. And I think this is where we've got to be absolutely spot on with communication. Communication out to the public, communication to all the big venues that the public are using, as I've previously said, so they know if anything happens, this is where we send them. And I think one of the things we've all said, we've got to take the A&E sign down because we've not been an A&E for a long, long time. And when I've talked about this one access point with people in the village and that, they've said, oh, thank goodness for that. And they said, well, it's never been A&E for many years, has it? Exactly. So we need to be clear on what they're having. And I think everybody's quite excited when we did the consultations. Obviously people are keen to keep it going, and they were very interested.
I think one of the proposals is that you call it an urgent care centre because that actually better describes what it says. Would you?
We looked around at other areas to see what they would say. We did have quite a few debates on it and wonder whether perhaps urgent care and A&E, but I think as long as we're quite clear to the public what we are. But urgent care, strangely enough, seems to be, not strange enough, but seems to be used across the country quite a lot. And when we finally decided on that day, next day the government announced about A&Es and we're having urgent care centres, so I think we all felt quite pleased that maybe we'd beaten them to it the day before.
So that's in line with the
government proposals, actually.
The Keogh report?
I think so, yes. Yeah.
So that's great. Excellent. Is there anything else you'd like to add?
No, one of the things that one of my colleagues is unable to be here today, and one of the things that we hope that we set up, this is a problem in GPs, surgeries as well, is that although she's aware that one of the common problems anywhere is space, but we need to make sure that there's a waiting area to all hospitals and that people can have some privacy rather than talking to receptionists and everybody can hear them around, that we need to build that in and make sure that we've got places that if they want to talk privately to someone beforehand, that they can do. We've got to be aware that we've got a very diverse population out there, both living and working within the borough, so we've got to meet the needs of all of those.
Indeed. And I think there are some people who either find it embarrassing to say
Yes.
how old they are, or my understanding is with some people that by saying their address out aloud, they feel as though their home is vulnerable if they're not there. So.
We need to be thoughtful of that and make sure, put the patient first, and make sure that we're doing it. And we can make it at ease when they come in there and they feel confident on it. And also, one of the discussions we've had is about making it sure that it's dementia friendly as well, because, and again, I think one of my colleagues have said that by doing that you make it better for everybody else as well. It's like making things for people with disabilities. It makes it more comfortable and easier for mums with babies and everybody else, sort of thing. So we just be a bit more thoughtful in how we design everything and do it.
Thank you very much. So, John, start off. It's nice to see you. And,
thank you very much.
And if you say what it is, how your interest is, etc., that'd be great.
Okay, so my interest is really as a patient and thinking about the other patients within the borough of Solihull. Right. As such, I do a bit of work with Healthwatch as a volunteer, and I'm also a member of the Solihull Pensioners, and I hear a lot of noise from these people about how worried they are going forward. It's very difficult now to actually get an appointment with your doctor for a regular appointment for 2 weeks. It's a terrific amount of time. Within that, if you have an urgent problem and it's a Saturday or a Sunday or out of hours, it's very difficult to get seen, and it's a long way to go to an accident and emergency department. I suppose I've been lucky really that I personally haven't had to have a lot of use of hospitals. I thank my lucky stars there, but the one occasion I did use the current walk-in centre at Solihull, it was excellent. Perhaps I could just quickly describe what happened. I woke up early one morning. I thought I'd actually got half a house brick in my eye. It was extremely painful. And thinking I may probably have to go into hospital, my wife suggested that we go to the walk-in centre, which we did, drove there, took 5 minutes to get there, I waited about 40 minutes in total, walked in, was seen very swiftly really by a doctor who within seconds had put an anaesthetic in my eye. The pain went in a nanosecond and I walked away with some more drops, and the problem was solved. That was all done within, an hour and a half. I was back home, no problems, with the prescription completed. I can't think I could have had a better service than I had there. As I say, that's the one occasion I've had to use it. But I hear a lot of people around the borough that I come in contact with that are worried going forward.
And so do they feel that is the idea then, as far as they're concerned, that they want to see the existing services be more accessible, but still maintained in Solihull Hospital site? Absolutely
maintained in the Solihull site. I mean, people in Solihull really do not enjoy having to go all the way to Heartlands. It's a long journey. If you don't have transport, it's a very long journey. And then there's waiting and so on and so forth. The service that we've got at the moment really is there are 4 bits I think that make up the whole section that we're talking about. There's the walk-in centre on its own, there's the Badger unit which operates out of hours, the MAU, the Medical Assessment Unit, and our so-called A&E department, which doesn't cover all aspects of emergencies anyway. And which one do you go to?
Yes.
What we're looking at here is trying to put together an area where you can walk in through one front door and be seen for whatever your problem is of urgent care. And I think that's really what it's all about, so that somebody will, triage, whatever, point you in the right direction and you can get it sorted. And we want that doing 24/7. I think that's very important that we can extend this, particularly so at the weekend. I know it's not too busy overnight, but it's still, people use these types of places overnight, and it will save them having to go into A&E, for example.
And they might use it more if they realised it was
They may.
24/7,
Yeah.
wouldn't they?
That's right. I don't think it should take the place of doctors' surgeries.
Yes.
For example, my own view, and people I've talked to, don't think there should be a registered list as such, but that it should be a true, proper walk-in centre where anybody can walk in from within the borough, or who's in the borough at the time, where they're working here or whatever, and go in at any time and be seen. But I don't think that should take away from our current doctors' surgeries, which are now providing more and more services generally that used to be provided by hospitals.
But it becomes more of a complementary. It's an also, isn't it? It's something. I suppose part of it is nowadays is people want it and they want it as soon as possible.
Absolutely, I think so. Yeah, that's very important. If you've got a problem, you want it sorting there and then. I mean, the same with my problem with my eye. I didn't want to hang around for any length of time. I wanted it sorting, and it was fantastic. I would recommend our current walk-in centre to anybody from that point of view.
As far as the A&E side of it is concerned, my understanding is that the plan is that they do away with the name A&E. Is that
That's correct, yes, because it isn't an A&E. There are no surgical facilities, no trauma facilities there. And you could, in fact, be giving yourself a problem if you went there with one of those sorts of problems yourself, in that it could exacerbate that problem, because you would then be sent from there to somewhere else, Heartlands or wherever. Whereas if people know and understand it is an urgent care centre, they can go there and be seen.
Well, one of the things that I think we said in the literature and everything is that says what it does on the tin.
Absolutely, absolutely,
so, yeah. As far as timescales, my understanding is, what would we be looking at if we're going out to consultation for engagement now with regard to getting tendering? When do you think, is it April 2016 that the service should be up and running?
If we look at what we've got to provide there in terms of the existing building that's being organised in conjunction with the Heart of England Foundation Trust through the hospital, I would think by the time we've actually gone out to tender, we've got back all the tenders, we've looked at them in detail, there's a lot of building work to be done, and the existing medical assessment unit will need moving. I would think we're probably looking at sort of early 2016. That would be the sort of timescale we'd be thinking of there, I would say.
Good.
The sooner the better for the people of Solihull, but I think it's of that sort of timescale.
Anything else you'd like to say?
Not only the excellent service that we've had, provided we can have a service that's as good as we're getting now, 24/7, I think I can report back to my pensioners and the other people that I come in contact with, and they will be very, very pleased. Thank you.
Good. Excellent.